You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, dental tourism. More and more people from all over the United States and Canada are traveling to Mexico to get their dental work done. With us, we have an expert on the topic. He is by far the leader in dental tourism. We have Dr. Arzate. Dr. Arzate, welcome to the program.
How are you, Randy?
Good. So did I get your name right there with
Yes.
Arzate? Is that right?
Yeah. Arzate.
Okay.
Arzate or Arzadi, whichever it sounds better, it's
Whichever's
okay.
easier. Now, for people that don't know your center in Cancun, I mean, you have a very large practice. People from where? All over the U.S. travel to see you. So who's your typical patient, and what are the procedures that you do there?
Well, our typical patient, it's basically all the tourists that go to Cancun, that they are from Canada and they are from the States, and they're willing to go to this beautiful place, sunny Cancun, and we really love it. And we have like more than 10 million tourists that go every year to Cancun and Riviera Maya, and they go to these beautiful resorts. They stay there 1 week, 2 weeks, depends on which package you have. But within those days, we can do lots of work. They could have only just like one implant or have a complete full mouth
So you do dental implants, you do cosmetic dentistry.
Yes.
And by the way, I looked at some of your videos.
Yeah.
You know, and people need to know it's a real interview. I'm not trying to side with you.
Yeah.
But very impressive. By the way, your lab, you have a huge lab.
Yeah.
In addition, you know, the patients seem to be pretty happy. But you call it take a dental vacation.
Yes.
Are people really doing it? Because I'm still skeptical that there are that many people that actually will do that. Will go on vacation and get their dental work done.
Well, usually back home, it takes like a month, 2 months, or you do some basic things. What we try to do is like make big changes on their way that they look. We do many types of treatments that is like, instead of doing like common treatments, like just go for one resin or one crown, why not? Let's do a little bit more work.
So you do like full mouth, like
Yes,
makeovers,
of
we
course,
call them
of
here.
course. Once I have you with me, what I try to do is like to understand what you're looking for. Like if you want to make a big change, yes, we can do it. If you have the time and you're here all these 1-2 weeks with us, we can do it. For me, it's the same to work with one tooth or make a complete full mouth rehabilitation, because at the end, it's like many of our patients, they have crowns, they have veneers, and they have been on their mouth for more than 10 years. So what we do is like try to give an option to give a change. Some patients, they say, well, I feel ugly, I feel like I don't have this confidence of smiling, this confidence about myself. I look like old, I have chipped, or I have teeth that they are like crooked, or they are chipped, or they look only old. I have some patients that they say, my teeth look old. Well, let's give a chance. We're on the first time on human being where we can do many changes. We can do, we have great technology. We have great treatments. We have the doctors, and if this is the perfect moment for cosmetics. You can do lots of things. You have even patients that they have done plastic surgery, facelift, or have many
They go there to
changes.
do this, haven't you?
Yeah, of course, because once you have done all that, but your smile is not as nice as you want it to. This is the first time right now where you can do many changes. So this is the era of cosmetics.
But you say, I mean, you know, look, I looked at some of your videos. I mean, things that may cost $70,000 or $80,000 here are about $15,000-$20,000 there.
Yeah.
Is that true?
Yes, of course. Actually,
How do you do it so low? Because my worry, and I took some notes, and I talked to some of my dental friends before knowing you were coming in. So I say respectfully, quality.
Yeah.
Because you're doing it 80% less, and even more sometimes.
Yeah.
What about quality?
Well, actually, quality, we have something.
And materials.
Yes.
You can't be using the same materials
I need
we
to
are
tell you something about Mexico.
Okay.
Mexico doesn't produce nothing. Everything's imported. I'm talking about dental materials.
Okay.
We don't produce nothing. Everything's imported. So everything's imported. I only use the best materials that are on the market. They come from the States, obviously, Germany, and Japan. All the porcelain that you see worldwide, it comes from these three places. So all these big companies that they produce this type of materials, obviously, we import them to Mexico.
So like dental implants.
Yeah, dental
Give me
implants.
some names, because the biggest
Well-
out here is Nobel Biocare. Do you?
Well, Nobel,
dental implants.
Straumann, MIS, 3i, Zimmer, we have all those brands also. So the same implant that you're going to have back home, we do it. The same implant. And actually the parts, what I try to do is like, I don't work with no clones, with no implants that they are cheap, or I'm not going to say from which countries they are, but I don't work with them. I only work with FDA approved implants. So
Okay.
in case you come here, you put an implant, and you can never come back and you need to go back home and you need like a replacement, any part or something, what I do is that I work the same implants that you have back home. And so your doctor will tell you, well, you have a good implant.
But
we
you
can
do
it
a lot of your training, or most of your training, here in the States?
Yes.
Is that right? I mean,
Yes.
you're here this weekend.
Yes.
To go to the biggest, I guess, conference for dental implant training.
Is
that right? Or one
it's
of
a
the-
maxi course. It's
What does that mean, a maxi course?
Maxi course. It's an accreditation. It's a 8-month accreditation that you're searching for this accreditation for the American Academy of Implant Dentistry. And
Why do you do it, by the way? Seriously, I mean, because you're in Mexico.
I
You don't
wanna-
have to do it. Why do you
No,
do
of
it?
course I have to do it because I need to be at the same level of what you have back home. The only difference is like for us as Mexicans, we have the same quality that you have back home. The only difference is that obviously price. Price is an issue, and they want to they don't want to spend 50,000 more here, so they want to travel, and even with the expenses of traveling, flight, and hotel, and have a great time, you can do the same thing.
What about safety? Because I know that,
Safety.
look, when it comes to Mexico, you know, a lot of people are worried about Mexico.
Yeah.
But for some reason, they're not worried about Cancun or Cancun.
Well, Cancun has been the #1 place for tourism for a long time. And what you heard about Mexico, I need to tell you because I love Mexico and I have Mexico here in my heart. And I really love my country. And it's real. Many things are real. And sometimes the news, well, they make it bigger.
Okay.
But you have insecurity, but that's more on the border. And I love all my country, but
Cancun is different than Tijuana.
Cancun is different. I need to tell you that Cancun is pretty safe, pretty safe, and you can go get a vacation. And as I told you, 10 million tourists can be making a mistake. We have that, and you will find beautiful places.
How do people hear about you? So the Canadians and the people here in the U.S.
Yeah.
Are these people that are traveling in Cancun and they see your advertisements there?
No. What we do is this: is that we have been working a lot with websites and a lot with the marketing.
So Google, they Google
yeah,
you.
they Google, and what they do is that they look for affordable dentistry. And one thing that we have right now is internet. That is a great moment for internet. There you can find so many.
Because you have a
things on
lot of
internet.
videos, by the way.
Yeah. And they even say that I don't speak English, so imagine that. So imagine that. You can say, the problem with the internet right now is that we're finding a machine, the searching machine, and it's a great one, but you can find so many things in
Now, are you
internet.
the spokesperson or you do the work?
I do the work.
Oh, really? Okay.
Yeah, I do the work because what I wanted to do is like to be like natural, like to tell patients like, well, you have another option. And I really admire all the American and Canadian dentists, and they're doing a great job. But they have also another option. That's why when I turned back to see a lot of doctors in Mexico or Costa Rica or Colombia or all those places, we are right now, this is the first moment where we can do so many things at the same level, because we all go to the same congresses and symposiums. So why not?
You like that? Okay, so the typical patients. Let's talk a little bit about
Yes.
the cosmetic dentistry and the dental implants.
Yeah.
So for cosmetic dentistry, who is an ideal candidate to go see you?
We have many patients that they go from, let's talk about women,
Okay.
from 40s all the way to 70s. I have this lady that she's 40 and she already has 2 kids. She wants to make a big change and she looks like it's time for her. Husband, kids, okay, they are doing okay, but she wants to make a big change. She already had a lot of other surgeries, like different stuff, you know,
Okay.
surgery.
To make herself look better.
Look
Okay.
better. But every day she looks at the mirror and she sees the same face.
She doesn't like her teeth.
Doesn't like their teeth. And so what I tell them is, what if I change the way you look, the way that you were gonna smile? And not only that, because it's not making teeth, it's not making a crown, it's not making a veneer. It's like the way that you look, the way that people see you, that confidence, that way of smiling. You're gonna be the first one smiling, because I don't know if you notice that every time when they are taking pictures on a birthday, what happens? You don't smile. You just
On a birthday.
Yeah, on a birthday. Yeah, you won't smile.
Can you see people walking around and you know that they don't like their smile?
Yes.
You can
yes.
tell?
Usually they look sad. They look like I'm angry with something. It's like this. It's like having all this technology right now, and you don't have a phone. It's like you're gonna be angry because there's this old technology around. This is the same thing. We're on the first era of cosmetics where you can do so many changes.
Now let's talk about your technology, because when I talked to you, I was very skeptical. I didn't want to interview you.
Yeah.
By the way,
Okay.
I thought, because we have a bit of a reputation here
Gotcha.
in the
Yeah.
U.S. and not to be a watchdog and say who's good and who's not, but I want to make sure. But you have a CT scan.
Yes.
There, you have your own lab. You have IV sedation you offer there.
Yes, of course.
You have this 130,000 or whatever machine that makes crowns right there.
Yeah.
So when it comes to technology, you have all the latest stuff.
Actually,
Is that right?
Actually, yeah, of course. Actually, what I try to do is, like, if you require IV sedation, we do it. And I love it because in Mexico, by law, an anesthesiologist needs to take care of you. And I love that because I take care of your teeth.
So you have to have a licensed anesthesiologist
Yes.
to do the sedation.
Yeah, and you know what? I
I
love
always
it.
feel like there's no rules over there.
No. I think this
So
is
you guys have rules over there.
Of course we have rules, and I can speak about all the dental doctors, all the Mexican doctors. They are real good.
What about being clean? Because we have high standards here
Yeah, I got you.
of dental offices.
Okay. Well,
Sterilization, things like that.
right now, autoclave, everything goes through an autoclave. And autoclaves, by the way, we don't produce nothing, everything's imported. So you have all types of machines, but they are all imported. This is the same machine we're using to sterilize the material, is the same one that your doctor has back home. Dentistry has a worldwide, health doesn't have no borders, no limits, and
So that's
same
it's a top priority for you.
Yeah, exactly. And materials, by the way, a doctor has I'm going to say a brand like Hugh Freedy. We have the same materials back there.
Okay, but one of the things
Yeah.
is people will come to me and say, I'm thinking about going to Mexico. This is before I met you, okay?
Okay.
I said, look, you're going to be looking at your smile for the next 20, 30 years.
Yeah.
Go to somebody that really does good work. It's worth spending a little bit extra money, okay? I said, you have to look at their before and after pictures because not everybody is an artist. Not everybody has an eye for it. So you have a lot of photos on your website?
I have lots of photos. All of them, by the way, if you go and see the before and afters, none of them, they have Photoshop.
Okay.
All of them are for real. So those ugly smiles, they are for real. And those before and afters are for real. One of the things that I tell my patients is, like, if you want me to make a beautiful smile, this is like, you give me lemons, I'll do lemonade. Each case is so different. And we need to take a look at you and see, what do you want? This smile design, it comes with the way that your face is.
Okay.
How big is your smile? Because not everyone smiles so big. Some people, they have like a small mouths, and probably you want them to be more wider, but you want the classical white, not so white. Actually, there's wider than mine, but we have all types of cases. Depends on where you live, how old are you. Like I told you, we have the 40-year-old woman that wants to make a change. But we also have lots of patients that they say, okay, I'm at the 60s or I'm at the 70s, and I want to make a change. Why not? I want to have the beautiful teeth that I always dreamed of. Now I can do it. That's what we're doing.
How do you do it so quickly, by the way?
Well,
okay, so somebody comes out,
Yeah.
because here, if you want to get veneers, let's say you want to get upper and lower veneers, I've done some research, it may take a month,
Okay.
month and a half, 2 months.
Okay.
How are you doing it so quick?
Well, let's say I'm going to give you like scenario, like a normal patient when they walk in, okay? They show up on a Sunday to Cancun. You just need to travel 3, 4, 5 hours, depends if you where you're coming from. Just book into your hotel. Show up on a Monday morning. Obviously, we have a great team of sales team that we have by the phone, and they are like dental advisors that they can help.
So a
you.
lot of it is worked out on the phone before they get there.
Yes, because
you
they-
even have a calculator.
Yes,
On
yes.
the-
Actually,
to talk
if you go
about
on the web,
prices.
if you go on our website, you have a calculator because the prices that you have there are the same price. There are no hiding fees. What you see there is what we're gonna charge. The only difference is like probably you send me an X-ray, and once I see you, I'm gonna give you. Well, you asked me for a veneer, and once I see the way that you bite and you have strong bite because you're I only see an X-ray, but I don't know if you're a tall guy, a strong guy, a tough guy, and I won't recommend you on that.
So you wait
probably on
until
that
they get there.
Yes.
Now, I
it
spoke
could
to
change
the
from
person-
a veneer to a crown.
But the person that runs your
Yeah.
office, I spoke
Yeah.
to her,
Yeah.
and she said most of the people, they arrive, we do treatment that same day.
Yes, of course. Yeah, yeah. You show up on a Monday, and we start to work on you on a Monday. And sometimes, let's say that you want to change like 10 upper veneers and 10 lower veneers, okay? This is what I wanted to tell you about timing. Once I have you there, and we already choose the patient, and we're going to choose the treatment, we're going to choose the color, size, and shape, we're all set.
But if there's only a week or 2 weeks,
Okay.
the part I'm not getting is that how are you doing the veneers so quickly? I mean, they need to, how do they know what their teeth are going to look like, is my question,
Well, we have
with veneers.
Once I have you there, we do a smile design, and I take a look at you clinically. What we decide both as a patient, as a doctor, is which color, size, shape is going to be and we also have a software where I can show you how they're going to look.
Okay.
What we do is that we start at that moment, we take impressions, and we perform those, we're talking about those 20 veneers. We perform those 20 veneers, and you will walk out with temporaries.
So like a temporary set of teeth?
Yeah, of course, of course.
So they get to see what they're going to look like
Well, I will have a replica of your teeth at that moment.
on your teeth.
Yes, of course.
Okay, well, that's good.
I prepare those veneers, and you will gonna walk out with veneers.
And then what? Enjoy your vacation
But
for a
they
little
are
while.
temporaries.
But
okay?
but you go away and do
Enjoy
your vacation.
Eat, drink, and do whatever you want to do on that vacation. Enjoy
Okay.
enjoy those all-inclusive hotels that we have in Cancun, and show up 4 or 5 days after. Meanwhile, we're doing that lab work. It doesn't matter.
So they're making the veneers.
Yes, of course.
These porcelain veneers.
yeah.
They're walking around with these temporary teeth.
Yes.
That look just like the veneers.
Yes.
So-
They
is that
look
right?
like a replica of your teeth, what you used to have.
Oh, what you used to have,
Because we're
okay.
performing a new ones.
All right.
The layout of the new ones, remember that we work like 1 or 2 millimeters below the gum, depends on each treatment, if it's going to be a veneer
Okay.
or a crown. And that way, what we're doing on the lab is we're designing those veneers. And usually it takes 3-4 days to design
come
them.
back?
They come back on Friday. Obviously, what we do is that
You
we
put 'em on?
replace those temporaries. We remove those temporaries, and we start the setting of those veneers and crowns. We do those final adjustments just to check and double check. Remember that the jaw moves in 360 degrees, so we need to check those vectors of angles of biting, chewing angles of grinding also. That's an important issue. We perform.
So you
an
do
eye
models
guard.
of the teeth to
Of
make
course.
sure that
Yeah, yeah,
the
yeah.
bite is right.
Yeah,
Okay. So you
exactly.
put the veneers on.
Yes.
So in a 4-day turnaround, if everything goes right,
Yes.
they're done.
Shouldn't be no problem, because what we do is that once we're
right.
doing what we're working on the teeth is like the same thing you're gonna do back home. Why it takes so long? I don't know. because each doctor, there are many ways to get to God, no? So we have different procedures. What we're trying to do is like dental tourism. It's like 1 week, let's say 2 weeks. But if we only have 1 week, I will never do something that I'm not going to be able to give you that warranty that I'm going to have it for you. And dentistry is the same worldwide. And what we're trying to do is like to perform something that we know, that we handle. We're sure of what we do.
So the cost of your 20 veneers
Yes.
is approximately like getting 8 or 9 veneers here.
Well, if we perform 20 veneers, you will have like 80%, 70 to 80% below of what you're going to pay here in the States or Canada. So that's one of the cool things of what we're doing. We're just having that dental vacation. We're giving you an option, a result, and we're also giving you this way of changing. No one will know because you're going to go on a vacation and they will never know if you have a suntan, if you did something, you look different, you look prettier. And I have lots of cases of patients that I change people's lives. Yeah, how? Because they go back and they start smiling. They are the first ones that start to smile. When there's a picture, now they smile. You're not going to be afraid putting on the bag without smiling. No, you're going to be the first one smiling. And even when you see a picture, you're going to be the first one in this, that is going to give a big sparkling smile.
The person that never smiled and now you're smiling all the time.
Exactly. So that gives you more confidence. Even
Okay.
when you're looking for a coffee, when you go get a coffee, even it's amazing.
They're going to treat you differently.
It's different
Because
because
you're
they
smiling.
say, I like your teeth. And you receive compliments probably about nice shoes, nice suit, or whatever. But now they start to see your teeth. Some patients, think about it, and I'm not selling you nothing. It's like it's the first time that people get compliments about their teeth.
Nice.
Probably they get compliments about the hair. I don't have none, but
Yeah, what happened? I was going to ask you about that. No, I'm kidding. Look, we are out of time, but I want to
Yeah.
talk to you about, because you do inexpensive dentures and you do dentures or a fixed set of teeth for dental implants.
Yes.
You say no more dentures.
yes,
You have a lot of training there.
yes,
And that's a big part of your business.
yes. We have wide, narrow, and mini implants. All of them, they are FDA approved. All of them are titanium. There are different brands, obviously. The ones that I work, as I told you, they are FDA approved. And depends on each case. Like, this is like shoes. You have all types of shoes for different things. Well, implants are for different things. And I've been trained in all those different procedures and all those type of implants, and all of them work. And we have done fixed dentures. Say bye-bye to glues, please. You don't need no more glues.
You don't like adhesives for denture wear.
Well, actually, you can use them, but there's another option. You don't need to put those glues on dentures. Right now, with implants, you can do so many things.
And you're about 80% off.
Yes.
And the quality, you say,
Yeah.
is just as good.
Well, actually, the dentures.
Is it
could be
just as good, or do you secretly think it's even better?
Well, I think it's better because of time, and it's also because more low cost. It's not cheap, it's more low cost. That's the difference.
Less expensive.
Less expensive because we have the same quality. The only difference is that we can make it in just a few times that you're here in Cancun.
So every week, would you say that people from the United States and Canada fly in to get their, veneers, their dental implants with you?
Yes. We see from 600 to 1,000 patients a year.
Okay.
And Canadians and Americans, they go to do lots of work. And one of the best things that we have is like they to find out that this is a great thing to do while they are doing a vacation.
You say when they arrive, they're impressed with
Yes.
your facility.
Of course they are, because what we do is that they think that they're going to find something like what they usually show on the news, or
Like
what
with the
they,
donkey and the
yeah, with a
sombrero?
donkey, sombrero, and all
That's
that.
what you told me in the green room, by the way. That's the only reason I
Yeah,
said
I know,
that.
I know. Well, unfortunately, that's what you see on the movies. What you see.
So
on
do you
the-
ever get referrals
Of course.
from these people?
We get referrals every week from patients that have been with us, and they just go get in contact to our website.
They say, go to these guys in Cancun.
Yeah, of course. www.cancundental.com, and we call them our dental advisors, and they will really help you.
Final message. Somebody watching
Yes.
this, they don't like their smile. Maybe
Okay.
they need dental implants, loose-fitting denture. What do you say to them?
There's a solution, first of all. There's an affordable solution that could be a good thing to know, and it's not so far away. Couple of hours, enjoy a beautiful vacation, get dental treatment, get a big change. Get a big change of what you were thinking it could be done because it's expensive.
And
it
you'll
will take
quote them a
long
price
time.
over the phone.
Of course.
So everybody gets a price over the phone before they go in.
Well, actually, what we try to do is this. First, get in contact to our website, and to our website, we will ask you for X-rays. X-rays help
But you
a
give
lot.
them estimates over the
Of
telephone.
course, yeah.
So everybody knows what they're going to pay beforehand.
Yes, they even do like.
Can't beat that.
Well, actually,
It's pretty good. I mean, that
what we
part
try-
is good.
What we try to do is like to be honest on what we're doing. There's no hiding prices, as I told
Because
you.
my biggest fear was get on a plane, go there, and then you realize, wow, this is a lot more.
No, you won't get that. Usually what we do is this, like even let's say that I don't know you and you show up, of course you will get something because we want to treat you right and we want to give you a solution. And we know what we're doing. We handle our product, we know how to do it, and you will get a solution. No matter if it's going to be only a resin or just a filling, or you want a complete makeover, or you want implants, or you want, we have a solution for you.
I want to thank you for coming to the show. Very good.
Oh, Randy,
very
thank
nice.
you, thank you,
Very
thank you
nice.
for your time, and I really appreciate all the thing that you have done for wellness and the wellness
Well,
hour.
it's definitely an option. You know, I think people, you know, our show is about options.
Yeah.
So now people have another option, and they
Yes.
could be the judge. They could go to your website.
Yes.
And get some,
CancunDental.com.
and if you like going to Cancun, you might as well go down there.
Oh,
right?
yeah.
And just visit the place.
Please take a look at Cancun. It's a great place. It's a great thing to do, to go to Cancun and have a dental vacation. It's great, and I really thank you for your time and this interview.
It's good stuff.
Yeah.
Thanks
I
a
like
lot.
it. I really like it.
Thanks.
Thank you, Randy.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again, if you only cut about 10 minutes, go to our website at wellnesshour.com. You just put in dental vacation, and you'll find him there. Or you can put in Dr. Arzate's name. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.